Hi, and welcome to Soma Psyche Soul. I am Jena, and today I am talking to you about the difference between traditional massage and somatic body work. If some of you have been with me for a while, you know that I recently went through a rebrand of my business, hence the name Soma Psyche Soul. This is because it truly embodies more of what I'm bringing to my business, to the services that I offer. And a huge part of that is based in somatic wellness because I'm specializing in that aspect of this field. So, if you're listening to this and you are not in North Carolina, I do want to take a moment to just showcase some differences for you because it might not pertain to you in the state that you live in. So, first and foremost, in the state of North Carolina, I am a licensed massage and bodywork practitioner or therapist. And in North Carolina, we are also licensed as somatic practitioners. So I just wanted to make sure that that was understood by someone in case they aren't in the state or don't have the knowledge of how our profession works here in North Carolina. Now, the other thing that I wanted to mention is that there is a difference between somatic practitioner and somatic therapist or a psychotherapist that utilizes somatic-based therapy. So that is also a difference in licensure. I am currently a psych major. I am a student to become a psychotherapist. So that is my pathway, and this is kind of my bridge. So my business now, I've been a body worker for 20 years, actually over 20 years now. And part of what I have always attributed to my own mental health wellness has been massage therapy. So way back when I first started school, I was dealing with really bad anxiety. Prior to that, I was dealing with severe anxiety in my late teen years. And so that really led into adulthood and still having social anxiety and just anxiety of anything having to do out in the general public. So I got up the nerve to go to school for massage after receiving my first massage. And that really was a game changer for me. My experience was one that helped to quiet and calm my mind. I was no longer feeling anxious. I felt really peaceful. And that was such a huge break for me to have that relief that I was like, wow, I want to help other people feel this. And so I got up the nerve to actually go to school and sign up and go through the program to do this because I really wanted to help people. And then after I got in the program, I was really amazed with all the other aspects of massage that help people, not just mentally and through how it helps the nervous system, but physically through medical massage and helping to alleviate pain or helping to recover from surgery or injury. And so my realm as a massage therapist really just cracked wide open. Prior to going to school, I was already involved in things like aromatherapy and reflexology and energy healing. So, massage to me was like that next level, that next step. And so I came into it already with a background in shamanic practices and energy healing and all of that. And so through school, I started diving into more of the medical or clinical side of massage and learning neuromuscular therapy and trigger point work and really diving into how I can physically help people. Now, fast forward, and there came a point in time in my business, in my career, where I had a client that got on my table that had been in a really bad car accident, and it left this client out of work for quite some time and a really bad shoulder injury. And so, what we recognized in the sessions was that even though she was coming weekly for sessions to help with the physical pain she was experiencing, when she was on the table, she would often start talking about the accident and how much it upended her life, how much it really just wreaked havoc on everything that was going on. And she was so stressed out and so caught up in the emotional entanglement of the traumatic event that she was in that even though I was doing all of the physical, manual massage work that I could do in clinical therapy, it was not helping to release that tension pattern that she continuously had. So even though physically working on her, I could notate the difference in the shoulder joint itself and what was happening in her shoulder. She was still experiencing pain, but that pain was not coming from that same injury that she had initially started coming from. It was coming from the surrounding tension in the fascia, which is the outer layer, right? So this was early on in my career, but what I recognized with that was that, oh, this is attached to her emotional feeling, her emotional connection to the accident. So, how can I navigate this session that embodies that too? And that is when I realized the power of weaving together both clinical medical style massage and energy healing practices, which brings that aspect into the session. It brings this kind of space holding to allow for healing to occur versus a step-by-step protocol for treatment of a specific medical issue, right? So it was having to weave together both. This was this was a client that really changed the dynamic of my career and my vision and my path going forward because she helped me to understand that both were equally important. And so I began to shift our sessions, and I, of course, asked her permission for weaving in some energy work into the session around the emotional entanglement she had from that accident. And together we were able to help her work through that. And that began to shift her mobility and her flexibility in her shoulder to the point where it was no longer causing pain. And she had felt like that weight was gone. And that was perhaps my first experience at really offering a somatic based practice, but I had no idea that's what it was at the time. Now, fast forward, 20 years into my career to now, and for the last 5 years, that is what I've been specializing in. So throughout this time, I have continued to weave together both worlds because I feel like it offers so much more depth into the session. However, with the last 5 years, really integrating my studies of somatic therapy and somatic practices, I've now understood a different layer of how and why things are working in the background in the nervous system of the body. And so it has again shifted my view of how I understand the body to work. And this brings me to our talk today around what's the difference between, traditional massage therapy versus a somatic bodywork session. So, traditional massage, I don't want to discount it. Massage is amazing. It truly, truly is. Whether you're getting a Swedish or relaxation-based massage, or if you're getting a deep tissue session, if that's your thing and that's what you like, then that's great. So I'm not here to discount traditional massage, but I do want to highlight the differences of what makes it different. So in massage therapy school, and having taught at two different community colleges as well for their massage therapy program, when you're taught what we call traditional massage, you're taught a Swedish massage technique, which is composed of 5 basic strokes. And those strokes may or may not all be included in your session. And of course, there's debate among us therapists whether or not that really makes it a true Swedish massage if you don't include all 5, but that's not for today's talk. What I want to discuss is, it's really a framework of this is the application of techniques. And then what you do with it as the therapist is the art behind the healing of that. So for some therapists, they tend to be a little bit more robotic in how they offer those techniques. And for other therapists, they tend to be more intuitive and connected into the body that's on the table to know what to do and when. And so there is a difference that is of course, there because we're dealing with individual people, and every therapist is going to have a different style. But in totality, when you're dealing with a traditional massage, it's basically a massage that has some sort of framework in place. So whether that is, they're following a traditional Swedish massage style, or they're following a clinical or medical massage style, or they are doing a deep tissue or anything like that, like they are following a framework that has been set out, that it comes from more traditional massage therapy practices that we have here in the Western world. Now, aside from that, there are what's called bodywork practices. And this is kind of part of what makes North Carolina a little different for us as professionals, because we are licensed as not just massage therapists, but bodywork therapists as well. And I see bodywork to be really different. So, bodywork to me is more of that intuitive approach. There's not the framework of you do this stroke, and then you do this stroke, and then you do this stroke, or you do this X amount of times on the body, right? And we see that a lot, even in the schools and how it's taught. And I never could wrap my brain around teaching that way, because that discounts the intuitive connection with the body on the table. And I always preferred to teach students from a perspective of developing that intuition and that feeling of connection with the body to know what to do when, versus a step-by-step guide. But that to me is part of what differentiates traditional massage therapy with body work. Body work really is working with the totality of the body, and it's taking everything into consideration. The person's, emotional state and how they're carrying that in the body, where their nervous system is at, what the tension is like on their body, and how you're feeling and sensing all of that together. What you're feeling from their spirit, if they're feeling high energy or low energy, and kind of what's going on in that realm too. And it's like you're able to read all of that, and you work that into how you are addressing the body, because you're allowing the body to lead. And really, that to me is the significant difference with body work, is it is a place where the practitioner comes in, and the practitioner comes in with a background of tools, but yet holds the space for the body to lead what it needs for its healing. And this comes from the understanding that the body naturally wants to be in homeostasis. So, if we can provide an environment for healing that is safe, that is connected, that provides a sense of connection and safety for the client, then we're able to help that body naturally begin to start initiating that process that it needs to establish homeostasis again. And so this might look like, holding a specific area of the body that feels a little tight or tense. And instead of focusing on our intellectual knowledge of different techniques we could use to forcibly create that tension to dissipate, we instead tune into the intuitive allowing, where we hold that tension and we allow the body to just naturally begin to talk to itself in the tension that's being held in that area, so that it slowly begins to unravel it. And what happens with the client on the table is their awareness is also being brought to that area of the body. And the beautiful thing about massage or body work is, in that quiet space, we are often allowing the spaciousness the client needs to actually enter a state of interoception. And so, interoception is a term that is used to describe going on that inward journey. So, the client is actually in their body, and they're now being aware of the area of the body that you're working on. And so when you move slowly and you're holding that area of tension, and you're just naturally allowing for that awareness to begin to drift and shift over to that area of tension, and you're holding it, and you're helping the body to bring awareness to that state, and you're helping the mind to bring awareness to that place, we then begin to breathe with the client, and we allow for the body to naturally begin to unravel. And as the client is experiencing that interoceptive journey, they begin to connect to what is being held there, what is underneath that. And this sometimes comes up like, something that they might not even realize was connected. It could be just a fleeting thought around an incident or a conversation or an argument or something of that nature that just kind of quickly comes up into their mind and just as quickly fades away, right? But that thread of attachment to what was connected to that tension was given space to actually arise into their awareness, to be processed and released. And sometimes the simplicity of processing truly is that simple. Now, that's not to say that there's not deeper layers of things that take a lot more time and gentleness to process and work through. But in this case, and what I'm referring to for the simple explanation to differentiate massage versus body work, it's really that space holding that is brought into the session that allows for the body on the table to lead the session versus intellectual aspect of step-by-step procedure that you see in a traditional style massage. So back to the bodywork aspect. Once that interoception and the layers come up and are released, you start to feel and notice as a practitioner, the tissue begins to soften, that tension begins to melt and release. And so you become aware and can often see the changes in the breathing pattern of the client or the facial expression or the holding pattern, or they might begin to move their body because they feel like it needs to be readjusted now that that tightness has released. And so that to me is the beauty of somatic body work. Now, I do want to talk about something else that I'm really passionate about. So if you follow me on my socials, you probably know because you've probably seen me have a few little rants around this. And so I do want to say this. I know earlier on in this video, I said, deep tissue if that's your thing, because there are people that just enjoy the deep pressure. But I will tell you, neuroscience now explains a lot better why deep tissue is not the answer. And a lot of people just don't know, they don't understand, or because they're following an old school train of thought that we were taught in massage school. But yeah, deep tissue, it signals to the body an injury to the area. So overall, it creates more tension. And I'm sorry, but it doesn't matter how gentle you go in with your deep tissue pressure. If you're doing deep work and you're doing a whole body like deep tissue massage, you are creating more tension for that person overall. And so it perpetuates that cycle of tension. So you might feel really good when you get off the table and maybe for the rest of that day. But the next day and the day after and the day after, that tension rebounds even more. And so you end up with increased tension and you end up with more pain. And so what I would like to share and spread awareness around is understanding that response in the body. And that is through understanding the connection of the nervous system to the contractile state of the muscles. And so this is why I feel like the future for massage therapy altogether as a practice needs to really coincide with the understanding of somatics and the neuroscience behind that neuromuscular connection so that we can work better as therapists to truly help our clients get out of pain. So if you were to think of, say, upper shoulder, neck, this area up here of the traps, right? We tend to carry stress up there, and that tends to be sore for a lot of people because a lot of people deal with stress, right? So if we're going to use this as an example, say a client comes in with super tight upper trapezius muscle here. And as the therapist, you're massaging, you're even warming up the muscle, and then you go in to deeply start stripping that muscle or digging in with deeper pressure all the way down in there. And the client is like tapping their feet on the table or tapping their hand on the table, right? And they're like, ooh, 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 ooh. That response is telling the nervous system that it's not safe, that there's an injury occurring to that area, and that surrounding tissue needs to tighten up in order to protect that area. Right. So there is this other aspect to massage that I think that needs to be understood more by massage therapists now. And that is the way that we work with the tissue really directly affects the state of the nervous system of the client too. And so when we're doing that work and we're creating that situation, now with the step-by-step process of like a manual clinical medical massage style treatment, you might get that muscle to release, especially if there's a trigger point in there or, just some built up adhesion in there. You might be able to get that to release, and it provides a relaxation response to that particular muscle. But if you don't go back and address the fascia, if you don't go back and address the nervous system response to that and create a felt sense of safety for that area and move that area around and allow it to reconnect through the neuromuscular system, then there increases a chance of almost like a dissociation from that. We call it sensory motor amnesia, where there's actually a disconnect between that neuromuscular connection to that muscle. And so the brain decides it's too much, not going to feel or connect to that area. It's just going to stay holding how it's holding, and that's it. Now, when we can gently begin to rework that area and move it and have the client actively contract and release the muscle, we invite that neuromuscular loop back in to repattern the muscle tissue. But see, in somatics, we don't have to always refer to that clinical or medical style of digging in if that's the type of deep tissue you're doing. And we can work with the nervous system response and the awareness and the neuromuscular response of just tuning into that area and addressing it through that movement pattern to begin with. And so there is a huge shift and change in the level of understanding and awareness of how the body is actually working. And that comes through understanding how the nervous system controls the contractile state of our muscles. And when we can directly communicate with the nervous system of the person, it allows us to more easily create a response in that muscle tissue. And so a lot of times in the somatic body work, it is, guiding someone through a certain cycle of breath work, right? To create a change in their nervous system, or it is holding the area and bringing awareness and creating a guided imagery around that area, releasing, relaxing, or melting, right? Or it is bringing the person back into their body so that they're aware of tension or pain that they're holding. Because a lot of times when people come in and they're coming in from, being in pain, they've already dissociated. They're not in their body because they don't want to feel the pain. And so it's kind of like having to titrate them back into their body and then let them escape a little bit, and then bring them back in their body and let them escape a little bit. And we do this through somatic practices. And so there is, to me, a huge difference between what is offered through traditional massage. And when I say traditional massage, I am coming from my years of experience in the field, my experience in teaching the massage therapy program, and what is out there in our massage therapy textbooks, which I'm sorry, they are so outdated and they really need to be updated. And someone really needs to start bridging the gap between what is coming out with neuroscience and the understanding of neuromuscular connection and the nervous system and massage. Like, that needs to happen desperately. Part of the work that I'm doing in my path, being in school for psychotherapy, is writing papers to help this field move forward in that connection, because I feel like it's just so disconnected from the current relevant understanding and information that's out there. So from the perspective of the client, the difference really is in the level of skill and understanding and expertise of the therapist that you choose to see. So I can say that I offer somatic body work, but my somatic body work might be different from someone else's. Right now, there isn't anything specific to training around somatic body work. There's lots of different styles out there and different thought forms around what that should look like and what that is. So I can't really give you a general overall because it can be vastly different, but I can tell you what I do and what is different with my sessions. And that is because I weave in, more of the somatic-based neuromuscular approach, somatic-based movement methods. So this looks like pandiculation, which is not the same as stretching. We don't stretch. That is another misconception that really needs to change. I still see massage therapists out there teaching stretching CEs and offering stretching to their clients. And let me just tell you again, when you learn more of how the body actually works, when you're stretching over tight muscles, you are signaling more tension. And so here again, if you find yourself feeling tight in the shoulders and you're like trying to stretch it out, right? It might feel good for like a few minutes after you do that, and then it begins to seize back up and tighten back up even more. And that is the stretch reflex response. And I think so many therapists have missed the education around that. You don't want to stretch tight muscles if they're over tight, if they're contracted and not from working out, right? So if you work out, yes, stretch after, it helps get the fluid moving back through the muscle tissue. But if you're not tight because you just worked out and you're tight because you're dealing with chronic stress and tension, you don't want to stretch that. You are going to make it worse. It perpetuates that cycle of tension from that stress reflex response. And so we want to instead pandiculate, which means we are actively contracting that muscle and we're breathing through that contraction, and then we're slowly releasing that muscle. And so it's slightly different from neuromuscular therapy, because in neuromuscular therapy, we will often do this contract relax process a couple of times, but there isn't much emphasis on the relaxation of it, versus in the somatic based neuromuscular practice, we contract it, but the emphasis is on that release and a very, very slow, controlled release. And that is because when we slow it down, and we're not just, contract release, when we slow it down, we are actually reconfiguring that pattern of that neuromuscular connection to that muscle. So that brain muscle connection through the nervous system of the different resting states of that muscle as it releases all the way down. It helps engage the prefrontal cortex and that sensory motor aspect to how our muscle is being held. And so there is a huge difference, even when you're talking in the realm of clinical medical massage versus coming at things from a somatic perspective versus, what has traditionally been taught. So as someone early on, right out of massage school, I jumped right into neuromuscular therapy. So that was something that was really key in my practice of wanting to help people in pain. Now bringing in that somatic understanding and knowing like, oh, there's another layer to this that is so powerful. And that is that really slow release to really repattern that neuromuscular connection for that specific area. And so my somatic body work includes things like that for the people that need that. Now, that's not to say every session gets that, because there again, it's about who's on the table and who's in front of me and how I can best work with that body, right? So it is holding the space for the body to communicate with me and what's going on. So another example is I just had a lovely client that um, super stressed, and I could tell even when she walked in the door, she was more stressed than usual. And when she got on the table, I noticed even just holding that upper back area, like scooping my hands underneath and just holding, I could feel the tension just in the superficial layers of the fascia. And I was like, oh, yeah, she is really bound up tight. And like it felt like a holding in. And so I just breathed with her and wanted to approach the session from a space of allowing the body to lead the session. And so what ended up happening is as I was scooped under and I was holding areas, I noticed a significant difference. So when I scooped my hands under and I was holding down around the mid back area, just at the bottom part of the shoulder blade, I was holding that area and I was like, okay, this still feels really connected. And then as I slid up and I got closer to more of the upper back area, it was like, ooh, that feels really disconnected. It feels like this is where all of it just kind of stops and where it begins to crunch in and contract in on itself. And so I held it for just a moment and just allowed for awareness to be brought to that space. And what came through for me in understanding that was like, oh, she's stuffing down a lot of emotions right now. That's what's causing this. And I got that because my background in shamanic practices and energy healing, I know like the heart energy and the throat energy, there is a significant block between there, and that was being held in her tissue. So that expression of emotional feeling was not allowed to come out. And so I just gently asked her, are you feeling like you're having to stuff down your emotions? Like, have you not been able to fully express what you feel? And she was like, yes. And that's been an ongoing problem. I just recently started therapy. And I said, great, because this is part of this tension you're carrying right here. I said, can you feel the difference in how it feels to you from this lower area to this area right here? Do you feel more disconnected from that? And she's like, yeah. I was like, yeah, because of that, that stuffing down of emotional energy, emotional feeling, it creates a block around the throat, which is going to transpire around the shoulders and upper back area. And so, because I allow my intuition to be part of the session and I allow myself to read what is happening with the person's body, I'm able to help explain, what's kind of going on and what's connected to that tension. And so, through that process, just being able to bring her awareness to that. Okay, just breathe into that space. We don't ever have to talk or go over any of the things that are coming up. It's just about your own internal awareness of what that is and working through that. And so it's a lot different than going to, say, a psychotherapist. Because you don't have to actually talk about and verbalize the things. This is about your felt sensation in the body and allowing that to be processed through that emotional mental processing, right? So it is your interoceptive journey that is part of the healing that you experience in a somatic bodywork session. So for this particular instance, it wasn't about pushing or trying to have some amazing release. And I know you'll see videos on social media all the time about, people having these amazing somatic releases and they're screaming and they're crying and they're convulsing. And a good somatic practitioner would never force a release. Never. That is not safe for your nervous system, and it is very re-traumatizing for the person. So do make sure as you explore out there what is there, you remember that a lot of it is marketing, a lot of it's for show, a lot of it is not telling the whole story. That's not to say somatic releases don't happen, they absolutely do, but it's not a forced thing. There has to be an awareness and an allowance that happens in a truly safe and trauma-informed space. So when you are looking for practitioners for this, please make sure you get someone that knows what they're doing so that it doesn't cause further harm. All right, that being said, back to somatic bodywork. I truly love offering somatic bodywork because it is a different way of approaching the body. It's a different way of approaching healing. It allows me to bring all of the tools into the session, right? To hold that space in the way that needs to be held specifically for you to help unravel those things that are connected. And the power behind that too is that you don't need the words, you don't need to verbalize. Find it funny as I talk about verbalizing and my voice starts to go. So you don't have to verbalize what that is. And a lot of times that's the hardest part of therapy for people, of having to relive and speak about it, actually verbalize, put the things into words, because so many people struggle with putting their feelings and emotions into words. And let me tell you, if that's you, you are not alone. Pretty much a majority of people have dealt with childhood trauma in some way, shape, or form. That has contributed to a disconnect to emotional feeling and not having the right languaging to actually put into words what you're feeling. So just know, if that's you, that you're definitely not alone. There are so many adults that struggle with that just in and of itself. They can't verbalize what they're feeling. And I know I definitely still have moments of that too, despite having a wealth of language now to use. It still is hard sometimes to tune into all of the felt sensations that are happening in the body in any given moment, and to be able to nail down what is the actual emotion that is tied to that I'm feeling connected to this, right? And it takes practice and it takes work. So I also want you to know, as someone that offers somatic healing, I also am doing this work for myself. And I think that that is so important too, right? As a shamanic practitioner and having so many years walking that path, I can also say that there is so much in shamanic practice that really mirrors psychotherapy. And I think that that would probably blow some people's minds, but for those of us that know that walk that path, we totally understand and get it. However, there's so much of that that really mirrors, how psychotherapy works, what you do with that. So for me, being able to have that background and use that in my own healing has been really, really helpful in my own journey. And so when I am weaving together all that I know in this work, it is coming from a plethora of resources that includes teachings in shamanism, teachings that have been passed down to me through elders, and understanding what those shamans used to do with holding space and communicating with clients and offering this heart-to-heart style communication, which was their therapy. And also understanding from the psychotherapist viewpoint of traditional, modern Western world, college schools, universities, of, learning psychology and understanding these step-by-step medical protocols for dealing with things too. And so being able to weave all of that together, and then the studies in somatic therapy and somatic psychology, somatic-based healing practices, like bring all of it together. And that is really what I am loving right now, because somatics has been like that missing centerpiece that explains why all of the other things work. And when you understand how and why it's working, you know exactly what it is you need to emphasize to create the change. So, whether you're going to get a traditional massage, which is amazing too, you get to zone out, you get to relax. It does help relax the nervous system. It does increase that parasympathetic state so that you can enter relaxation and inner peace. There's also more work that can be done. So if you're someone that, experiences tension and you know it's tied to your emotions, when you're stressed, you tend to feel more pain. If you are just going through a difficult time and it's creating more pain in the body or creating more anxiety in your life, then somatic body work might work better for you so that we can address that specifically and work together through that. So that is really the biggest difference. Do you really want specific work that is tailored to the nervous system and what is happening with you? Or do you just want a traditional style massage? So those are the differences. Now, that being said, with traditional style massage, I do also bring in all of the tools and resources because I can't not do that. I can't speak for everyone else, but for myself, when I have someone that signs up or schedules a session, like I step into that session wanting to do everything that I can do to help that person. But my limitation is based on the session that they chose to schedule. So if they are scheduling a therapeutic massage, then it stays in the box of everything that fits into therapeutic massage. If they are scheduling an energy healing session, then anything that fits into that box is in that box, right? So they're not going to be receiving a massage. However, when it comes to somatic work, that key difference of offering somatic based movement practices and incorporating more somatic neuromuscular techniques and different somatic practices to draw you back into awareness and into the areas of the body and allow for that emotional processing to occur in your journey. That is what is different with my somatic body work. And it really helps to break those chains of tension that are connected to emotional responses. And that is really what tends to bother a majority of people that come in the door. They are experiencing the tension that occurs from their emotional responses to things. So I highly recommend trying that. And if you're someone that, deals with maybe anxiety or depression or PTSD, or you just have, a lot of overwhelm or high stress that is hard to deal with, then the integrative somatic reset body work is my total package that includes the somatic healing work, it includes the somatic yoga work of movement, and then it includes the body work as well, so that you're getting all of it together in a way that you also get to leave with a practice that you can do on your own in between your sessions so that you can help your own nervous system come back to that place of centeredness, of peace, of relaxation, so that you are feeling more connected to yourself and not stuck in those patterns of overwhelm or anxiety or frustration, right? So that is a practice that really helps for that and is a way that allows me to help you develop your personalized plan of what will work for you. Because the other key thing that not a lot of people understand or know is that, yes, there's a lot of somatic based practices out there. But if you don't understand the communication language of your nervous system, to know where your nervous system is, to understand what it's saying, to understand the way that it is communicating with you, you can use all the somatic practices you want, but if you're using the wrong ones, it's not going to work. This is why you need to find someone that knows what they're doing, because someone that believes that just breath work is the answer or just movement is the answer, that tells me that they are missing some key understanding on how the nervous system works and communicates, because there is never one simple answer. So I hope that helps you to understand some of the differences and explains why somatic bodywork might be more beneficial in some ways and helps you to better navigate what session might be best for you. So, let me know if you have more questions. I will definitely be creating some more videos around this, and I look forward to talking to you more and answering any questions you have. So definitely leave them below if you have questions, or if you want to reach out privately, you can find me on my socials and message me through one of those channels. Those are linked below as well. Thank you so much for tuning in.